So there's a lot of, EMDR has 8 phases, and then there's a 3-prong, past, present, future. Then there's the 8 procedural steps, which is different than the 8 phases. And then I come along and say, well, there's also 6 stages of transformation. And like, what is all this? So I guess humans need to put things in categories. So the 8 phases is like from the first time you meet a client till the first time you follow up after an EMDR session. The 8 phases live in that area. So phase 1 is just an intake and getting to know them, people, find out what the problem is. Maybe you do a little introduction about EMDR. That's phase 1. Then you also talk about we have to do a preparation phase, which is affect management, where we teach them a safe, secure place. And then the 3rd phase is asking them and fill out the procedural steps. That's called the assessment. Stage 4 is when you start your hand. When your hand moves, you're in stage 4. And then stage 5 is while we're in the midst of an EMDR session, the negative belief usually will shift to the positive belief, and the distress level will decrease. So as that starts to heal, you install a positive thought, which is often the opposite, like I'm good enough would be the positive thought. So you go back to the negative image, and you pair it with a positive thought, and then you continue to reinforce the positive thought and to see if it holds up, thinking about the negative image. That's the 5th stage. The 6th stage is at the end of the session. We do what's called a body scan. We just ask the client to close their eyes and just notice if there's any uncomfortable body sensations, because EMDR activates body sensations. The 7th phase is just sort of talking to the client about, you may have dreams or nightmares, or if anything really starts to upset you, please call, and, just kind of preparing them to leave. And then this phase 8 is when they come back and we just said, how's that memory? And that's phase 8. So basically, from the time you meet till the time they come back after the first EMDR session, that's the phases. So that's like a global view of the work. The 8 procedural steps is that phase 3 piece where you're just filling it out. Here's my memory that's upsetting. Here's the thought, and then we rate it on these scales. Here's the emotions I feel, the body sensations. So those are the procedural steps. Now my 6 stages, like the 8 phases, live in those 6 stages. Like the 8 phases, you can just spend some time on stage 3, just dismantling and doing the history and working all these traumas. So you go through these 8 phases many times. And then it shifts to the chaos and confusion stage. So you're doing those 8 phases again a little bit, but usually present focused targets instead of historic stuff usually. So those 8 phases kind of live in each of these stages. The stages are like a sonata, and the phases are like the theme of the sonata, and through these different periods that a sonata would go through to get to the other end.